Welcome to Nz-Osce learning sessions. Today we will go through Station 7, Medication Administration. In this station, you have to read the scenario carefully for 2 minutes. Here, you are a registered nurse working in the morning shift in an orthopedic ward. Your patient is so-and-so, a New Zealand European. She is admitted in the ward with pubic rami fracture and is on conservative treatment. She is non-case of epilepsy and has been taking Epilum solution -mg twice daily. She hasn't reported any allergic to any medication. Her vital signs are already checked and documented. Our recommendations are: you have to administer the morning due dose of Epilum, check for any allergy, follow 3 checks and 5 rides while administering medication. And finally, you have to document the medications you are given. Once you read the scenario for 2 minutes, your countdown begins for 8 minutes and warning bell at 6 minutes. As always, knock the door before entering the room, look around for scene safety, close the door to ensure privacy, and perform hand hygiene. And you have to initiate your conversation like this way: hello, good morning, introduce yourself. I'm so and so, I'm your assigned nurse on duty. I'm here to give your due medication. How are you feeling now? Have you had your breakfast? Or, hi, I'm your assigned nurse today. I'm here to give your morning medication. How are you feeling? Did you have your breakfast? So like this way you have to introduce yourself. And moving further, you have to confirm the patient identity by asking that, for better confirmation, could you please tell me your name, date of birth and NHID please? And you have to match it with the patient file or ID band. Once done, okay, let me check your file first. So once you entered the room, you have to introduce yourself and you have to explain the purpose of your visit. And moving further, you have to confirm the patient identity. Okay, let's check the file for the medication chart. Okay, I can see the drug chart in like this way. It's mentioned the date, time, generic name of that medicine, appropriate dose, frequency, prescriber's sign. So you have to read the drug order loudly by saying, okay, your morning due medication Epilum or sodium valproate -mg oral is on due. Make sure it's legible, valid and signed by a doctor. So these informations you can see in the drug chart. You have to verbalize it's clearly like it's legible and valid. You have to ask important questions or you have to be checked certain criteria. First of all, you have to explain the procedure and you have to obtain the consent. Like, is it okay if I give your medication right now? By asking that, shall I proceed with this giving medication? And secondly, you have to check for any allergic history. Do you have any non-allergies? And you have to explain the procedure and you should assess their knowledge level regarding this particular medication. Like, I know that you have been on this medication for 3 years. Do you know why? Or would you like me to explain more regarding this medication? If needed, you have to provide brief teaching if required. You have to check this medication by calculating the dose of that particular medication. Calculate the dose by using this formula. As you all know, desired dose divided by stock strength into volume. So the amount to be given you will get. So firstly, you have to check the dosage of this medication by using this formula. By second check, by preparing the medication by draw the medicine into the syringe and look it at the eye level and place it on the tray. And third check, ask for a colleague or you have to verbalize like this way that I need to cross verify with one of my colleague. This is so and so medication for this patient and confirmed correct expiry, route, everything you have to mention. You had to continue your conversation like this way. I hope you know about this medicine, Epilim. Do you want to know more about your medication? Yes, I need, or yes, I know, because I am taking this medication for seizures for last 3 years. Okay, that's great. Have you experienced any side effects so far, or do you experience any allergic history so far to this any medication, or particular to this medication? Oh, no, not yet. But sometimes I may experience nausea or vomiting. Oh, I'm sure this drug doesn't have any major side effects. Usually, if you experience nausea, vomiting, and GI disturbance too. And one more thing I would like to add is it's better to take Epilim at the same time each day for best effect. So, by saying that, you explained or you given health education regarding that particular drug. Okay, I'm going to prepare the medication for you. I'm taking this bottle from the medicine rack. It's mentioned that sodium valproate, it's available in so and so mg in ml, and its expiry is so and so. Okay, my prescribed dose is so and so mg, but it's available in different. Maybe it's different. If the prescribed dose sometimes 300 mg, it's maybe available in 250 or 200 mg or in ml. Okay, so our equation says that as you all know what amount to give, that is desired dose as prescribed dose divided by stock strength, that is available dose, into volume, that means in ml. That will give you what amount to give to that patient. So prescribed dose divided by available dose into ml, that is volume, that will give an value of what amount to give to that patient. So that's in the first check. Is that clear? Once done, you have to go on with second check. Once you took the medicine, you have to remove the cap appropriately and fix it with an adapter. It will be available over there. And once done, you have to connect the syringe tightly with that adapter. Check the medicine in the eye level, and you have to verbalize like this way: this is sodium valproate, it's available for my patient in so and so ml. And keep the syringe and place it in a kidney tray. So you draw the medication into the syringe, look at it at the eye level and place it on the tray. Am I clear? Second check we finished. In the third check, ask a colleague, or you have to say, verbalize that I need to cross verify your medicine with my colleague. This is sodium valproate prescribed for this patient. It's available in this mg, and my calculated dose is so and so. Okay, I am ready with your medicine right now. You are ready with your medication. Okay, you told me that you don't have any allergies so far to any kind of medicine. Am I right? Yes, nurse. Could you please tell me your name once again? Okay, my name is so and so. Okay, it's better to be in proper position. Do you want me to administer your medicine? No, sister, I will do that. That's really great. Let me document your medication in the chart. Okay. I will be back after 30 minutes for evaluation. If you feel any uneasiness or if you need anything, please press the bell. I am here to help you. Keep in mind, always follow 3 checks before, during and after the preparation. And keep in mind 5 rights of medication like right patient, right drug, right dose, right time and right route. Don't forget to document and check for any type of allergies. Am I clear so far? That's all about Station 7 medication administration.